Hello, my name is Teresa Brannon. I am the Manager for Training and Technical Assistance at the National Center for Health and the Aging, a project of North American Management. Welcome and thank you to everyone for attending today's webinar. This webinar is being recorded and the slides will be emailed to you after the webinar has finished. And there will be a question and answer session at the end of the webinar. This publication was made possible by grant number U30C722743 from the Health Resources and Services Administration, Bureau of Primary Health Care, and its contents are solely the responsibility of the authors and do not necessarily represent the official views of HRSA. Today we are honored to have as a presenter Ms. Sarah Hoshaw. Today she will talk to us about how a community health center in rural Indiana was able to use innovative health outreach programs to connect with their senior rural population. And Sarah, Ms. Hoshaw is from HealthLinc, and she will discuss social determinants that affect the health and rural communities in senior population. And she will focus on planning strategies and health engagement projects to help improve the health within rural neighborhoods. And finally, Ms. Hoshaw will focus on a strategic doing approach to bring together individuals in rural communities to participate in monthly meetings and many other outreach models to help improve access and the quality of health in your rural population. Ms. Sarah Hoshaw works for HealthLinc as the Director of Corporate Strategy. HealthLinc is a network of 6 community health centers in the state of Indiana that offers medical, dental, and behavioral health services across 6 counties. Currently, Sarah's responsibilities and areas of oversight include community needs assessment, business development, grant management, and other special projects. Previously, Sarah worked for St. Joseph Regional Medical Center. She was instrumental in the development of St. Joseph's new $355 million facility, managing over $6.5 million worth of products and infrastructure for the facility. Ms. Hoshaw's role included vendor and bid selections, architectural design and product analysis, contract reviews, and implementation and move planning. Sarah worked as a project manager with the organization, assisting with projects that impacted various areas, including preparations for several health reform initiatives, financial performance, strategic development, and operational efficiency. Ms. Hoshaw completed her Bachelor's of Science in Biology at St. Mary's College in 2002. She has worked as a crisis pregnancy counselor at the Women's Care Center prior to entering and completing a Master's of Health Administration at the Ohio State University in 2005. Upon graduation, Sarah completed a fellowship program in health administration with Trinity Health, leading to her physician experience at SJRMC and ultimately employment with HealthLinc. Aside from her professional life, Sarah volunteers on several local boards and committees and enjoys time with her family and friends. Ms. Hoshaw.
All right, well, thank you very much. I want to thank everybody that has decided to join the webinar today. We're going to go through several different types of activities here. We're going to talk about a couple of different scenarios with the objective of really kind of getting you to think about some of your planning initiatives a little bit differently than maybe you have before, so you can open up some new opportunities. So our objective, we'll talk about outreach. I'll give you a quick overview of HealthLinc. We're going to talk about the social determinants and how important those are in terms of unifying a rural health community together. We'll talk about engaging community leadership and even more broadly the community itself. We'll talk and go over what we're calling a strategic doing approach to community health improvement that you can hopefully replicate in your own scenarios. And we'll talk about the importance of getting cross-sector industry involvement in your planning, and we'll walk through a very senior-focused example on how you can start to look at situations a little bit differently. So the HealthLinc Overview, as Teresa mentioned, we are a network of 6 community health centers, all federally qualified health centers that cover 6 different counties in northern Indiana. We'll actually be receiving a 7th site at the end of this year, which is our mobile medical and dental unit that's in production. So we're excited about that, specifically so we can get out to a lot of our communities, but also really engage with a lot of our school age patients that we haven't been able to engage with yet out in the community. All of our locations are a mixture of suburban, with at least one of them being rural, and some of our other counties starting to bridge into that rural environment. We provide medical, dental care, behavioral care, and then as we are opening up a new replacement site for one of our clinics, we'll actually be adding optometry as well. So you can get an idea about our size. In 2012, we served just under 19,000 patients with over 75,000 visits. Our payer mix is mostly Medicaid at 43%, our uninsured at 33%. Our Medicare percentage overall is 9%. However, in one of our community centers, that percentage jumps up to 18%, so a significant part of their population. And then, of course, the rest is commercial. So what I'm going to talk about first is a planning project that we did for community health improvement that we wanted to be a very kind of grassroots focused effort in one of our communities. And we've seen this as something that's been more advantageous than any other approach we've used before. And wanted to share that with you so we can replicate it in different scenarios. So the situation is that our clinic down in Knox, Indiana had actually always done very well for itself. However, the county is a very poor county, and so we started to not necessarily feel bad about the work we were doing with our own patients, but that we weren't necessarily getting the breadth of outreach and kind of impact on the whole community that we really wanted to see. And we knew that the community had a significant number of challenges that they were facing, and we were feeling bad that there wasn't some way that we felt like we were impacting those. And so at that time, Robert Wood Johnson had also come out with their county health rankings. So each year as they released those, we were looking at those. Knox, which is in Stark County. Stark County had, in 2011, was ranked 91st for their health outcomes and health factors out of 92 counties in the entire state, so second to last in the state. In 2012, they got a little bit better in their health outcomes at 90th place, but their health factors went down to 92. And then recently, in 2013, they did progress a little bit at 88th place for health outcomes, but we're still only at 90th place, so they're still down at the bottom for their health factors and those things that we know can help improve health. So my boss had a conversation with the State Department of Health and said, you know, we're really trying to make a difference down here in this county, but we're not exactly sure what else we can do besides what we're doing. And we were able to receive a grant from the State Department of Health to create a health plan for the county. So as I go through these scenarios, I put down some of our lessons learned at each of our phases. And in this one, particularly just ask. Ask the people that you're involved with at your state levels or, you know, in other organizations how you can partner and what you can actually do together. And for that simple question led us the ability to receive a small amount of funds to go forward and do something a little bit different than we had done before. So our approach, again, we really didn't know what to do in such a rural community. So we established a team of ourselves, and we worked with an organization called Better Healthcare for Indiana, which was promoting that all health improvement needs to start within local communities and was helping communities facilitate health improvement and even building coalitions if they were ready for that. So we worked with them, and we figured that we wanted it to be grassroots. We'll go out and ask the people in the communities what they really felt they needed to focus on to do what we said was to make Stark County the healthiest place to live and work in Indiana. So we started with that very broad open question of what would the county look like if it was the healthiest place. And as we worked and integrated ourselves and talked with all of those leaders, our discussions were very eye-opening. We expected to hear things like, there's not enough doctors in this area, there's not enough specialists here, or patients can't afford to come in for care, and that's not what we heard. We immediately actually started to get the participants to brainstorm, and they started coming up with positive solutions of what they wanted their county to look like And they started also talking about the challenges, but it was in relation to that ideal picture that they were starting to have and what barriers stood between their current state and that ideal picture. And again, these are just in some very small, short conversations. And people started to share challenges such as generational patterns of unemployment, low educational attainment, just general apathy in the community, inadequate childhood development and child care, adolescent health issues and choices that adolescents were making in the community. And then overall, there's a big concern about drug abuse in the county and high incarceration rates related to that. So again, not necessarily things that related to health necessarily from our perspective at our clinic, but really related to all those social determinants. So without looking at the social determinants, we can never have unified these leaders' comments together to get to that healthiest state of Stark County. So after we talked with all of these leaders, they actually left feeling extremely intrigued and very vibrant about what we could do. We brought them all together in a leadership meeting, and their motivation was still very high. We told them what we heard across the community, and together we defined some very specific focus areas that they felt we needed to work in to have the biggest impact we could have. We made sure that we had a cross-sector of people involved from every type of area of the organization, including city government, including schools, including economic development agencies, including businesses and faith communities and social services. So all sorts of individuals were present. And we planned 2 community forums, and those were particularly important, and we invited all the leaders we talked to personally invite anybody in their network that they felt absolutely had to be there. And with the positive motivation that we had given them out of our discussions, we actually ended up having a significant number of people that we could personally invite to these scenarios. So from that first phase, some of the lessons that we learned was that the leaders in these rural communities were very diverse, much more diverse than we kind of expected. Many grew up there. Many had lived elsewhere and had experiences that they could bring from other places. And all of these people together created a very creative environment. So that's something to think about as you're choosing the leaders that you want to interact with. Again, starting with that open-ended question of what would the county look like if it was the healthiest place to live, started us off on a very positive note and a great deal of energy behind it. So that was really important to us. Now, also the Robert Wood Johnson Foundation social determinants were important. Again, the leaders couldn't even get past those to start talking about other issues of health. And it became a very unifying factor for all of us. We used this as a guide to set our focus areas, so we knew we weren't straying from things that wouldn't have a big impact on health. But we didn't actually focus on the numbers. We more focused on the types of things that Robert Wood Johnson identified as being important contributors to health. And then again, the attendees and the approach at the forums that you have is extremely important. You have to think about the rural communities and that a lot of them get planning dollars. A lot of them get things for community development or economic development. So I've been through a lot of these scenarios where they're talking about mission statements and they're identifying their strengths and their weaknesses. And what you're doing has to be different. It has to end on a positive note. And it has to be something that when you get together, your result you can impact very quickly and have with some pretty swift actions. So we use 2 models in our planning and in our facilitation. This is the image from Robert Wood Johnson Foundation that we use very consistently. Again, this is what helps us stay focused. And again, we make sure there's a cross-sector of people involved from all these different types of areas of social determinants so we can have the broadest impact possible and the most buy-in. The second model we use is a type of planning called strategic doing. If you want to look it up, it's out of the Purdue Center for Regional Development. And it was developed because typical strategic planning projects, end up with huge, big business plans with, 50-some action items that don't always get implemented. And this pattern of kind of brainstorming and identifying what you should do together can be done pretty quickly and is much better for today's fast-paced environment. So in the end, when you use strategic doing, you end up answering what could you do together, what should we do together, and what will we do together, and then basically what your next steps are. So here's the main steps to a strategic doing process that would help with your brainstorming. And if it can fit on one slide, hopefully it's easy, right? So we started again with the open-ended question. So if you have your own scenario you want to work through, think of how you would phrase a question very positively and very open-ended to make sure you're not kind of insinuating any other barriers for people. So have a very positive question. And then what you do is you start discussing all of the assets that you have in your community. And don't limit it based on just assets available for a specific type of issue, but list every single asset. And that can be people assets, both leaders in the community or leaders of organizations, or it could be people with specific expertise or specific passions. So people that like to be involved in healthcare improvement, like physical activity and doing training, people that enjoy the history of the area, because the more assets that you can list down, the more that you're going to find creative ways to link them together and find other networks to branch out to that you had never thought of before. So linking and leveraging those assets really allows you to make sure you're getting a good subset of people involved, and make sure that you're identifying the resources that are already actually existent in your community. A lot of strategic planning, you start talking about things you want to do, but you don't have the money or the people or the expertise yet to do it. This, you were talking about things that already physically exist, and you can start and engage with them tomorrow. And when you look at the assets that you have and you start bringing them into these scenarios, you're already building buy-in. So these are people that maybe you've never reached out to before. Now you're reaching out to them, and they're already starting to feel engaged and valued because of the way that they can interact in the opportunity that you're developing. So you link the assets together. You see what new opportunities happen to come out of that, new events, new programs, new scenarios. And then you pick what specific outcome you want to have. So an example for us was as we went through the planning sessions, we identified that we had a very strong set of leaders that had different experiences within our community. We had at the table all of the local school systems within the county were willing to start working on some of these health-related issues with the students. And we had an extremely strong, very strong after-school program that was heralded by many people in the community. And so linking those things together, we came up with a strategic outcome of engaging 25 mentors out of the leadership group that we had identified within the next year to mentor children at the youth club to encourage hope, academic success, and healthy lifestyle choices. So this is not earth-shattering, crazy scenarios here, but it's something that had not been linked and opportunized before. So after you do that with your strategic outcome, you do a quick action plan. So again, nothing completely unusual here, but the trick is asking, what are you going to do in the next 2 weeks? What are you going to do in the next month? And what are you going to do in the next 2 to 3 months? So again, trying to keep building on your momentum and get things done very quickly. And then, of course, you want to schedule your follow-up meeting. And then after you get done doing all this, you realize that you've built this big network with all of the assets that you have, all the people that you've invited. And then that branches out then to even more people that they can bring in their organizations and their families and their friends. So this is the approach in a very short summary. You can steal this as much as you want. So what could we do together? That's your brainstorming and you're connecting your assets and developing an opportunity. what should we do together is focusing on that opportunity and defining what you want your outcome to be. What will we do together, your action plan with your milestones, and then your quick 30-30, what's your next step in the next meeting. And of course, make sure you get your participant list, because some people like to sneak in and out and don't always give you their full name, so that's important to make sure you're capturing all of that while you have them there. And we found our forums really successful, and so I put the agendas here in case you wanted to replicate it. They did last for about 2.5 hours, which is somewhat long, but we did break them into 2 of them. In our first one, we reviewed the focus areas the leaders came up with and made sure that the rest of the community agreed that those were important areas to work on. And then we broke out into breakout sessions where we did the asset mapping, identified the top opportunities, and each group identified at least 2. And then we got the whole group back together. Everybody reported on their 2 best opportunities that they thought should be implemented. And then everybody got to vote on what they thought was, the top opportunities that the group should carry forward. That itself, again, helps you build a lot of buy-in so that you can leave the day with everybody feeling that they've got to contribute and that the most important things were identified. And then Forum 2, we came back, we recapped, we defined those initiatives further, we developed the action plans, gave report on those, and then we talked about sustaining this project going forward. It was really important for us with a sense of motivation that there was going to be a responsible group going forward. And the group did identify that there was no entity and that the leadership group that was involved with planning these forums continued to help progress going forward. And all of the individuals that attended signed commitment pledges to the different projects that they wanted to work on. And we collected those at the end and assigned people to different groups. So our outcomes, we had 4 projects. So it's pretty amazing, we think, out of those 2 forums. We ended up with 4 solid projects we can work on. We had ongoing commitment from people, from them signing those pledges. We had a leadership team that had agreed to continue to go forward. And we had said we were going to work on and have project teams related to each one of the projects that were identified here. Our lessons learned from this point in the project so far is that the strategic doing method we felt really, really worked for us. It takes a And it's not just providing transportation for your patients themselves, but asking the transportation entity, what do they see in terms of their senior people that come on the bus? Where are they going? What are they doing? What do they need help with? In terms of health, of course, we relate with other healthcare entities, but definitely partnering with other existing health fairs, doing the health fair are actually doing screenings at senior centers. We, of course, partner with SHIP. We also found out that one of our hospitals has a senior navigator program. So as you look at all these healthcare entities that are preparing for healthcare reform and broader collaboration with their community, one of our local ones had put up a navigator position just to help seniors that they see in their health system get services within their health system or within their local community. So we partnered with their senior navigator. Senior exercise programs. Didn't really think about that, but those are people already engaged and ready to work on their health. And from a perspective, again, of becoming a patient-centered medical home, looking at those barriers to care plans and potentially implementing community health workers in the future to help address those barriers. I had never thought a whole lot about safety, but we had worked previously with the Triad program. As I started to look at all the assets in our community, there's a lot of people that work on safety issues that you wouldn't necessarily think would be the first place to go for senior outreach, but they encounter seniors, and so they have a lot of experience in terms of seniors being in situations where they need help and assistance, and so there's a lot we can learn from them. So we worked with the Triad program here, who helps keep patients in their homes and make sure they have a safe environment. You could also work with police and EMS. In terms of safety, not just physical safety and environmental safety, but also safety with medications. You can work with local pharmacies and get ideas from them on how else you can partner in outreach for seniors. And then, of course, there's always spiritual health with church outreach, health fairs, tables after actual events like their picnics and stuff. And then socialization, you know, is a large part of seniors' life at their senior centers. Or what about volunteer groups that go out and visit people that are homebound? They probably visit a lot of seniors too. And we found our community events were big places to meet seniors or to even partner with community events if they haven't thought about having a seniors day or doing senior-related activities as a way to engage with them. And then, of course, we've met people out at places like libraries, and we had to think about where seniors go out in the community, and for some of us in one of our communities, that was McDonald's. That's where they went and got their coffee. So that was a good place we found to meet them too. And then, of course, you have your other agencies like Council on Aging, Area Action Agencies, and Energy Assistance Programs, which sometimes, again, you think are helping individuals that are smaller families that are just trying to make it, but they do help many seniors too. And so to wrap up here, I wanted to give a senior-specific example of something that's happening in our Valparaiso community. And when you think about the strategic doing approach we talked about earlier, this is something that can be easily developed or something similar by using that approach and working with different leaders and people engaged in your own community. Excuse me. This is a scenario that has a very wide community impact. So it's called Elder Style Valparaiso. It was a partnership formed between the Valparaiso Department of Parks and Recreation and a retirement center. And their initiative, they engaged people across the community that you can see there, and their role was having a commitment to combine all of their efforts and support healthy living and create a network of community choices that will enable older adults to live well. And this is all in preparation for our generations continuing to age. So this is kind of the strategic plan that Elder Style came up with, so that they are preparing for more seniors to be entering into their local environment. They're developing resource centers of all sorts of agencies that help seniors. They're evaluating what gaps there are in those. They're engaging the community by going out to events and educating people on their Elder Style implementation. They're working also on the built environment, so they're actually physically talking about what is available in the community in terms of pathways and sidewalks and how seniors can actually physically and socially move about in their community and what needs to change. So as the city is making repairs, they're working together to do what would allow seniors to interact with their environment a lot easier. And then they're strengthening the safe net. So engaging and developing access points throughout the entire community that can help seniors get access to all these resources. Now, this has actually touched us. So when you think about application, just in terms of hitting us as an entity that provides service to seniors, this changed a way of how we were looking at some of our stuff that we were doing. And a specific example is with our HealthLinc facility that we're doing in Valparaiso. So we have, thinking about seniors, we made sure the entryway was covered. It was on the bus line. We had the bus kind of rerouted to come right up to the front of our building. There's no ledges. Everything is easy to walk into the facility. You don't have to step over any transoms or anything. All of the curb sizes, if there are any curbs in the whole area, are the appropriate size for a senior individual to be able to step up onto if they have to. We have a big community center that will help us engage not just with seniors, but all sorts of entities. And, of course, it was important for us that we continue to expand our services for those that are in need. And with the seniors, it's very important that we have the dental and the optometry. And one of the things that we learned is with the socialization of seniors. A lot of them talked about how they loved going down to Florida. They were able to go out to locations where they were meeting other individuals, or they had place and spaces to interact with each other. And a lot of that happened at the shuffleboard court. Well, we don't have shuffleboard courts in Indiana. And so we're actually looking at the ability for us to create that kind of gathering space that's so important for them at our own new facility. So that's kind of just an example of how this process has kind of impacted us and our outreach and how we think about things a little bit differently. And I'm willing to go ahead and take any questions now.
Very much. Thank you, Ms. Hoshaw, very much for that presentation. It was excellent. And I do have some questions that have come in. One is, where does the money come from to partner with businesses and corporations? Are the services they provide subsidized or free?
For us, so far, with all the projects that we've worked on, we had, of course, the grant that the State Department of Health gave us to actually do the planning activities. From this point forward, right now, those have funds have just come through our partnerships with entities. We found people that had similar objectives to us and had similar things that they wanted to achieve and are willing to buy into. So we've worked with other entities like the local hospital, the Chamber of Commerce that already has to plan events. And so far we've been very fortunate in that together as a community, and that speaks to the power of the network and who you're inviting in, we've been able to collaborate on these and look at the existing resources. Now, we were able to receive some funds from a local community grant that's going to help us continue to develop the Moving Stark County Across America campaign. So we are continuing to look for grants, and we're looking at incorporating so we can even continue to get more grants. But again, I would encourage you to look at the partnerships. We work a lot with our Medicaid agencies too, and they have different outreach activities that they have to do, and some funds associated with that. So between all of us, we've been able to bring those resources together.
Great. So the next question is, for spiritual health, is it limited to churches, or is there inclusion for spiritual engagement? And if you have used other groups, how responsive are the seniors to outreach?
In terms of the spiritual health, we've mostly worked with the churches right now. I mean, we haven't done anything very specifically related to the spiritual health of our patients. I don't know if that's something that's going to come out as we continue to develop our patient-centered medical home and we look at barriers. But we definitely have those resources at hand so that if we need to refer seniors to spiritual resources, to help connect them back into the community, we can do that. And I'm sorry, what was the second part of that question?
And if you used other groups, how responsive were the seniors to outreach?
I guess at least in terms of the groups that I kind of talked about at the end of the presentation, all of them have been extremely responsive. We've taken our outreach to be not just an informational thing, but we're willing to try and sit down with people and talk to them. And so you just have to be creative in finding good point people to talk with at the organization that has direct connection with the seniors that they work with. And many of them, have been very advantageous in letting us kind of engage with those individuals.
Okay. The next question is, does your organization offer education or job training for those who want to go back into the workforce?
Our entity does not. Again, as HealthLinc, we're a community health center, and so we partner, though, with other agencies. So we work very closely with Ivy Tech, and we help educate and bring students into the health centers that are interested in health-related careers. We also, down in Stark County, we are working with the Skills Center down there that is a workforce development program. So as we interview people and we find out what their barriers are and what their goals are as an individual that's preventing them from being healthy, we have that set of resources that we could then refer them out to. So as an entity of HealthLinc, no, but that again is why we have the partnerships, because we know that we can't do it all.
Okay, so you may have already answered this question, but do you have seniors on staff that are from the community that are in your health center?
Well, to be honest, I don't really go around asking people's age, but we do have a few individuals that are towards the older end of the spectrum. Now, as much as how much outreach, I don't have that department reporting to me directly, but as much as we have worked with them specifically, I know that some of them have gone out or have recommended places for us to go out into the community. Again, a lot of those have been religious-oriented organizations, so connecting us with church contacts and stuff, or other smaller groups. So like in Knox, I mentioned there's like that homemakers group that can connect us to partnership groups like that are places where seniors gather. So just definitely asking the staff where they think we should go has opened up a bunch of opportunities that we hadn't been to before. And that really creates that personal aspect. So when you talk about getting seniors engaged and allowing seniors to be more open to hearing what you have to say, if it's coming from that personal invitation from somebody, that makes it even more effective.
All right, excellent. I think I don't see any more questions coming through at the moment. Is there anything that you would like to add before we wrap up the presentation?
No, I don't think so. I mean, I'm definitely willing and open if anybody wants to kind of talk about an approach or an idea a little bit further, just to kind of relate that to some areas where we've had success or share some of the areas where we've had some lessons learned too. I'm definitely willing to help anybody that's kind of looking at a new opportunity they want to approach.
Okay. Well, Ms. Sarah Hoshaw, as I said before, we are honored that you were a presenter today to talk about rural health outreach for seniors. And I would like to say thank you to all the participants today that joined us for the webinar. And I would like to say a special thank you to HRSA for the grant that makes all these webinars possible. And if everyone wants, we have ended the webinar, please complete the post survey that will pop up on your screen. This actually helps us to improve webinar presentations that we bring to you from the National Center for Health and the Aging. And if you have any questions, always we are here for training and technical assistance. for everyone. If just call any one of our talented staff members, and we will help you with any kind of comments, issues, or questions that you have. So once again, thank you everyone for joining us today. And Ms. Hoshaw, thank you very much for the presentation.
Well, thank you very much for the opportunity.